A very good morning to Dr. Janice and all my fellow friends. My name is Juliana Giljani, and before I start with our group's presentation for today, the first thing that I want all of you to do is to think. Where do you think your future would be today if you had never gone to school, never received health care, or never had access to clean water? For millions of people around the world, this is not just a question, it is their reality. Now imagine if everyone in this room starts with the same phone, the same money, and the same opportunities. Would everyone still end up with the same success? Probably not, because life chances are not equal. Some people are born with access to education, healthcare, and basic needs, while others are not. This gap is what the Sustainable Development Goals, or SDGs, aim to address. It is introduced by the United Nations in 2015. The SDGs are a global plan with 17 goals to end poverty, protect the planet, and improve people's quality of life by 2030. Today, our group will focus only on the first 6 goals, which cover some of the most basic human needs: no poverty, zero hunger, good health and well-being, quality education, gender equality, and clean water and sanitation. Without further ado, let's begin with SDG 1.
Okay, good morning everyone. My name is Hazik Mazim Farhan bin Amin, and for today's Sustainable Development School, I will tell about the first SDGs called No Poverty. For this report highlight, I will give it to 4 parts. The first part is why SDGs, the No Poverty, matters to the world. The second part is the SDGs 1 progressions throughout the year from 2015 to 2025. The part 3 is the working poor and what can we conclude. And the last part is the timeline from 2016 to 2025. As why SDG wants the no poverty matters to the world, we know that it can be improve the quality of life, it can promote economic growth, reduce inequality, the others nation can invest in the future generation. We can also promote peace and social stabilities, reduce hunger and also malnutrition, specifically in the region of Africans, build resilience against crisis, and also supports the others SDG. Throughout the year, we can see the progression that we can see starting from the years of 2016 until 2018. The progressions achieved of no poverty by 2030 seems to be in a good progressions among the 3 years. For the first 3 years, the poverty rate continued to decline year by year, and this can be seen as a good progression done by the entire world to achieve the goals of zero poverty. But during the 2019, we know that the trends turn out to be slowdowns because of the COVID-19 that hits the world at the middle of 2019, and the progressions toward achieving the goal has been slow significantly. By the years 2020 until 2022, the poverty rates around the world kept increasing by year. And with the war that happening at that time with Ukraine and Russia, it has to make 75 to 95 million more people at risk to extreme poverty. After the end of the Russian-Ukraine war by 2023, it's still ongoing, but it's a little bit settled down right now. We can also see that the progression at that time remained off tracks, and the world is still trying to recover from the post-COVID era. With all these events that is happening in the world right now, SDG 1 are likely to be achieved by 2030 without a strong action by uh, countries, nation, or even UNHCR. Here's the conclusion about the 2016 to 2025 era. You can see that in 2016, significant progress has been made in reducing the global poverty, but billion people still live in the extreme poverty, highlighting that the needs of continuous effort to achieve SDG 1. Poverty levels in 2017 continue to decline, but significant challenge remains in ensuring that no one was left behind. By the years 2018, The poverty reduction continued, but the inequality, limited social protection, and also vulnerability to crisis remained major challenge. During the years of 2019, we can know the COVID-19 hit the world, the pace has been slow, and the world is not on track to achieving the target by the end of 2030. In 2022, the world still in COVID-19 era that has been hit by the slow progression to achieve the targets that keep getting slower. 2021 marked a setback for SDG 1 after people start living with COVID-19 as the pandemic increased the poverty and also exposed the vulnerability of many communities. The combined crisis in 2022, however, the COVID-19 and war between Russia and Ukraine could lead to the additional 75 to 95 million people living in extreme poverty in the years of 2022. The progress for the years 2023 toward the ending poverty remain off tracks, with the global crisis continuing the slow poverty reduction and leaving the millions of people vulnerable to extreme poverty. By the year 2024, the poverty rate has returned to pre-pandemic level, except the low-income countries such as Africa, South African regions, the South Asians, and the South American. So, in conclusion, despite the progress is in expanding the social protection and reducing the poverty over the past decade, millions of people still live in extreme poverty, and the current effort remains insufficient to achieve SDG 1. That's all from me. Thank you.
Good morning. My name is Hosian with my metric number BB241104228. It's my turn to present the SDG 2 Zero Hunger. In this section, I will briefly explain the global hunger trends from 2016 until 2025, child nutrition, regional food security, the main causes of hunger, and the initiative introduced to achieve the zero hunger. Before going deep down in my presentation, there are five parts that I will be presenting today. The part 1 is introduction of SDG 2. Next, the part 2, global hunger trends with the graph. The part 3, child nutrition and regional impacts with the graph 2. The part 4, the causes of hunger, and the last part is agriculture initiatives. Firstly, let me start with the introduction to SDG 2, Zero Hunger. SDG 2 aims to end hunger, achieve food security, improve nutrition, and promote sustainable agriculture by 2030. So why it is so matter to us? It is important because over 800 million people globally still face hunger, especially the young children which are under 5 years old. So this presentation covers global trends, child nutrition, regional differences, causes, and the solutions. These slides show global hunger trends from 2016 until 2025. From 2016 to 2017, around 800 to 850 million people were affected by hunger, and about 155 million children were stunted. Next, in 2018 until 2019, hunger increased to about 821 million, mainly due to the conflict and the climate change causes. During 2020 to 2021, COVID-19 caused major disruptions and sharply increased the hunger of levels. The last one is 2022 until 2025. Global crises continue again, with more than 100 million additional people affected, and food prices also increase. So overall, the hunger issue shows an increasing trend and remains a serious global issue. So this graph shows the global hunger trend from 2016 until 2025. Overall, we can see that the global hunger has followed an increasing trend over the years. In 2016, about 800 million people were affected by hunger, and this number continued to rise gradually. The most significant increase happened during 2020 and 2021. Because of the COVID-19 pandemic, many countries experience lockdowns, disruptions in food supply chains, loss of jobs, and rising food prices, make it more difficult or for people to access enough food. As a result, the number of people facing hunger reached its highest point of around 900 million in 2021. Although the trend slightly decreased after 2022, the number of people affected by the issue of hunger remain very high. This shows that the world has not fully recovered and global hunger continues to be a major challenge. Therefore, more efforts are needed to achieve for SDG 2, Zero Hunger by 2030. Moving on to the next slides is talking about the child nutrition and regional insights. Globally, about 149 to 155 million children suffer from stunting, while 40 to 52 million children are affected by wasting. In addition, around 38 to 41 million children are overweight, showing a double burden of malnutrition. The main drivers of hunger include conflicts, climate change, economic crisis, and COVID-19 pandemic issue. Regionally, Sub-Saharan Africa has the highest food insecurity, while Southern Asia also faces serious challenges, although among some programs like school gardens and smallholder supports are improving the situation. So overall, child malnutrition and regional inequality remain major global challenges under this issue, which the SDG 2 Zero Hunger. So by just now, I was shown the graph of the global hunger trends. Now it's turn to moving on to the child nutrition and regional insights graph. This slide shows the main child nutrition indicators under SDG 2, which are stunting, wasting, and overweight. Firstly, stunting is the most serious issue, affecting around 150 million children globally. This usually happens due to long-term poor nutrition, especially during early childhood, and it can affect a child's growth and development. Secondly, wasting affects around 40 to 50 million children. This is more immediate and dangerous condition where children are too thin for their height, often caused by severe food shortage or illness. So for the third thing is overweight. So overweight affects about 38 until 41 million children, which shows another side of malnutrition. This is usually linked to unhealthy diets and lifestyle changes, especially in urban areas. Overall, this data shows a double burden of malnutrition, meaning some children suffer from not enough food, while others suffer from unhealthy eating habits. This clearly shows that children are still very vulnerable under global food insecurity. Well, after I present the graph of showing the global hunger trends and child nutrition, now it's moving on to the next data graph is shows regional insights. This graph is shows the regional food security comparison with the interpretations, and I took Sub-Saharan Africa, Southern Asia, Latin America, and the others nations for during the comparisons. So the hunger levels differ across regions. Sub-Saharan Africa has the highest hunger level that can be seen from the graph. Next, the Southern Asia is the second highest affected region. Besides, Latin America has moderate food insecurity, for the other regions show lower hunger levels. So there are some reasons that will cause this issue happen, which possibly will be caused by the poverty, conflict, climate change, and also the economic situations. Okay, so for the next slides, I will explain the causes of hunger in SDG 2. There are some reasons that, because of these reasons, so it will happen the global hunger issue become more seriously. The first one is the conflicts and wars. Armed conflicts disrupt food production and distribution, making the food scarce in many regions. For the second reason, which caused by the climate change, for example, drought, floods, and extreme weather reduce crop yields and hurt farming communities. So that's why there are many people, because of there are not enough food, the food scars, the problem of the food scars, making them no, making there's no food to eat. So for the next reason, which caused by economic shocks, because of rising food prices, inflation, and debt, make it hard for families to buy enough food. So we can see that there are many families, and in each families there are each children. For each children in the family will affected by the hunger issue. The last reason, which the COVID-19 pandemic. So this is a very serious and significant historic, and become the most serious reason for the cause the hunger. So for this reason, the school closures and disrupted food supply chains increased the problem of hunger, especially among the children. Now, coming to the final parts of SDG 2 Zero Hunger, I will explain the agriculture initiatives and solutions for how to solve the zero hunger problem. So, after I've been explained the introduction of SDG 2, why is so matter, and showing the graph of global hunger trends, child nutrition, and regional insights. Also, I explain the causes of hunger, and now I will continue. My last part is to explain the initiatives and solutions. So, in addressing the SDG 2, several agriculture initiatives have been introduced between 2016 and 2025 to improve the food security globally. So let we see the first initiative is to climate smart agriculture. This initiative is important because it helps farmers to adapt to the climate change while increasing food production in a sustainable way. For the second initiative is to improve the farming techniques such as better irrigation, soil management, and having a modern farming tools, be able to increase the productivity and reduce the crop loss. Third, support for smallholder farmer is essential, as providing seeds, tools, and financial aid helps improve the rural livelihoods. In addition, local, innov- local agricultural innovations also play an important role to solve the zero hunger problem. I will take one example like Bhutan chili farming because of improving because of they have the new innovation, so it helps to improve the income and food production. School feeding and garden programs also play a key role in improving the child nutrition and promoting agricultural educations in formal way, which in school. So for the last one is the initiatives of food aid and social protections programs such as cash transfer help vulnerable families access basic nutrition during their economic difficulties. Overall, these initiatives work together to reduce hunger and improve global food security. So these are my presentation parts. That's all from me. Thank you.
Now I will present the Sustainable Development SDG 3, which is a good, healthy, and well-being. This goal is focused on ensuring life healthy and promoting well-being for all people at all ages. At this part, I will explain 5 main points, which is what is SDG 3, the trend of SDG 3 from 2016 until 2025. The third is finding of global life expected. The second is finding tuberculosis incident. Lastly, I will explain about the challenges and solution of this SDG 3. What is SDG 3? SDG 3 is ensure the healthy life and promote well-being for everyone. The main target is include reducing maternal death, ending preventable newborn and child death, fighting disease such as HIV, tuberculosis, and malaria, and improving access to vaccine, medicine, and healthy care. SDG 3 is important because good healthy help people to study, work, and live better and contribute to society. The important area include the maternal healthy, vaccination, healthy coverage, child survival, mental healthy, and healthy environment. For the SDG 3 trend, from 2016 until 2019, SDG 3 is show a good progress before COVID-19. Maternal and child mortality declined, life expected improved, and HIV-related deaths decreased. However, from 2020 until 2022, the COVID-19 pandemic distributed the healthy progress worldwide. The life expected dropped, and many child missed the routine vaccination. From 2023 until 2025, there's some recovery, but SDG 3 is still off track. Maternal and under 5 mortality continue to improve, but tuberculosis and malaria remain the major challenges. Global life expected trend. This graph shows the life expected increase from 66.8 years in 2000 to 73.1 years in 2019. This shows that global healthy improved because of better healthy care, disease prevention, maternal and child healthy, and medical access. However, life expected dropped to 71.4 years in 2021 because of COVID-19. This means the pandemic reversed nearly 10 years of progress in global life expected. For the next slide, tuberculosis incident trend. In this graph, show that tuberculosis case decreased from 150 case per 100,000 population in 2015 to 119 case in 2020. This show progress in reducing tuberculosis during the early SDG period. However, the cases increased again to 134 in 2021. This happened because COVID-19 distributed the tuberculosis diagnosis, treatment, prevention service. For the challenges and solution, there are three main challenges for the SDG 3. The first one is healthy care access. Many people have limited access to healthy service, medicine, and healthy worker. The second one is disease and vaccination, where tuberculosis, malaria, and HIV missed the routine vaccine, remain a serious healthy issue. The third challenge is mental health and inequality, where many people face anxiety and depression, and healthy care access is still unequal, especially for the poor, rural, and vulnerable community. For the solution, country need to build a stronger healthy system by building more clinic and hospital, provide more medicine, and training more healthy worker. The next is prevention and awareness should be improved through vaccination, healthy education, and disease prevention. Lastly, healthy care should be affordable and accessible for everyone, especially for poor and rural community.
Now, when we hear the word education, most of us probably think about classrooms, exams, and homework. But education is much more than that. It is the key that opens the door to better jobs, better health, and better quality of life. In fact, without education, achieving many of the other sustainable development goals would be much more difficult. That's why education is not just another SDG, it is the foundation for many of them. This brings us to SDG 4, Quality Education. SDG 4 aims to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. In simple words, it is about making sure that everyone, regardless of their background, has the chance to learn, develop skills, and build a better future. Now let's have a look at how global education has changed over the past 10 years. We can divide the trend into 4 phases. The first phase was from 2016 and 2019. The first phase shows a steady improvement. During these years, more children enrolled in school, government invested more in education, and literacy rates continued to improve. Based on the graph, primary school completion increased from about 83% to 86%, lower secondary from 71% to 74%, and upper secondary school from 49% to 53%. However, this progress was not equal everywhere. Many low-income regions still struggled with poverty, limited school facilities, and a shortage of qualified teachers, meaning that many children could enter school but were still unable to receive quality education. The second phase marked the largest setback in global education, which is from 2020 to 2021. This is because the COVID-19 pandemic forced schools around the world to close, affecting around 1.6 billion learners. As shown in the graph, school completion rates drop across all education levels. The biggest challenge during this period was learning inequality. While some students could continue learning online, millions of others had no internet access, no digital devices, or even electricity. This created a learning gap that many countries are still trying to close today. The third phase shows the beginning of recovery, which is from 2022 and 2023. As schools reopened, governments introduced learning recovery programs, improved teacher training, and expanded digital education. The graph shows that completion rates started to increase again, with primary education reaching around 86%, lower secondary 76%, and upper secondary 56%. Although education was improving, the challenge was no longer just reopening schools. The focus shift to helping students recover the knowledge and skills they had lost during the pandemic, especially in reading and mathematics. The final phase shows that education continues to improve, which is from 2024 and 2025. According to the United Nations SDG Report 2025, primary school completion reached 88%, lower secondary 78%, upper secondary 61%, and the global youth literacy rates increased to 93%. These numbers shows encouraging progress. However, the world is still not on track to achieve SDG 4 by 2030. The challenge today is no longer simply getting children into school. It is ensuring that every child stays in school, completes their education, and receive quality learning, regardless of where they live or their family background. In conclusion, SDG 4 is not just about giving everyone the opportunity to receive a quality education and build a better future. Over the past decade, we have seen progress, setbacks, recovery, and continued improvement. Although the world has moved forward, millions of children are still being left behind. This reminds us that achieving SDG 4 is not only about building more school, but it is about ensuring that every child has an equal opportunity to learn, succeed, and reach their full potential. Thank you.
Hello everyone, my name is Hayden Eden with the metric number BB24161209. Today I will be presenting SDG 5, which focuses on gender equality. Here I will discuss its trends, progress, challenges, and recommendations from 2016 to 2025. The main goal of SDG 5 is to achieve gender equality and empower all women and girls. Over the past decade, significant improvements have been made, although many challenges still remain. So first, let us understand what SDG 5 is about. SDG 5, or Gender Equality, is one of the 17 Sustainable Development Goals introduced by the United Nations in 2015. It aims to ensure equal rights and opportunities for all, especially women and girls, by eliminating discrimination and unequal treatment based on gender. Gender equality is considered a basic human right and is important for achieving social, economic, and sustainable development worldwide. So there are several positive trends from 2016 to 2025. So more women are entering professional careers and participating in politics. Technology and digital platforms are also being used more by women. In addition, there is greater focus on reducing the gender pay gap, supporting women in STEM fields, improving digital literacy, and recognizing unpaid care and household work. Governments are also becoming more aware of the importance of gender-responsive policies. Several indicators show that progress has been made. More girls are completing their education and more women are holding leadership and political positions. Women's rights are receiving greater attention in national policies, and public discussions about workplace equality and gender-based violence have increased. Female participation in the workforce has also risen in many countries. Between 2016 and 2025, there has been good progress in gender equality. Many countries have introduced laws to protect women from discrimination and violence. More girls are completing secondary and higher education, and more women are taking part in politics and leadership positions. Access to reproductive health care has improved, and there is growing support for women's businesses and entrepreneurship. Women and girls also have better access to technology and digital opportunities. Despite the progress, many challenges still exist. Gender-based violence such as domestic violence and sexual harassment remains a major problem. Women also face economic inequality, including lower wages and fewer opportunities for leadership positions. In some countries, cultural beliefs and stereotypes still limit women's roles. Some girls continue to face difficulties in accessing education and technology. Global crises such as COVID-19 and climate change have also affected women and girls more severely. Several actions can help improve gender equality. Governments should strengthen laws that protect women's rights and provide equal opportunities in education and employment. Support for women-owned businesses and equal pay policies should be increased. More women should be encouraged to take leadership roles through training and mentorship programs. Education and digital skills should be made accessible to all girls and women. At the same time, support for victims of gender-based violence should be strengthened, and awareness campaigns should continue to promote respect and equality. Families and workplaces should also encourage the sharing of household and caregiving responsibilities. For the graph Global Gender Gap Index from 2016 to 2025, in 2016 it is 0.683, while in 2025 it is 0.688. So based on the graph, the Global Gender Gap Index showed gradual improvement between 2016 and 2025, indicating progress toward gender equality worldwide. Although the COVID-19 pandemic temporarily slowed progress in 2021, recovery in subsequent years demonstrates continued efforts by governments and organizations to reduce gender disparities. However, the pace of improvement remains relatively slow, suggesting that further actions are required to achieve full gender equality by 2030. So for this graph, women in STEM fields, in 2016 it is in 28%, and 2025 it is at 33%. The proportion of women working in STEM-related occupations increased consistently during the period, reflecting growing support for female education and careers in science and technology. This positive trend demonstrates increased awareness of the importance of gender diversity in innovation and technological development. Despite this progress, women remain underrepresented in many STEM fields, highlighting the need for continued investment in education, mentorship, and equal opportunities. For the graph, female labor rate participation, in 2016 it is 46.8%, and in 2025 it is 48.1%. Women's participation in the labor force generally increased from 2016 to 2025, despite a temporary decline caused by the COVID-19 pandemic. The recovery observed after 2021 highlights the resilience of female employment and the growing importance of women's contributions to economic development. However, barriers such as wage inequality, limited career advancement opportunities, and unpaid caregiving responsibilities continue to restrict women's full participation in the workforce. So this graph shows women in national parliaments. In 2016 it is at 23.1%, and in 2025 it shows at 27.5%. So the percentage of women holding seats in national parliament increased steadily throughout the period, reflecting greater female participation in political leadership and decision-making. This trend suggests that policies promoting gender-inclusive governance have had positive effects. Nevertheless, women are still underrepresented in many countries, indicating that more efforts are needed to achieve balanced political representation. In conclusion, important progress has been made toward gender equality between 2016 and 2025. Women now have better access to education, healthcare, employment, and leadership opportunities. However, challenges such as violence, wage gaps, and discrimination still remain. Therefore, stronger policies, better education, and more economic opportunities are needed to achieve SDG 5 and create a fair and sustainable future for everyone. That is all from me. Thank you.
Good morning everyone. I'm Jolunavi, matrix number BB241107995. Today, I will be presenting Sustainable Development Goal 6, which is clean water and sanitation. This goal focuses on making sure everyone has access to safe, clean water and proper sanitation by the year 2030. In this presentation, I will cover four main parts. First, the introduction to SDG 6, second, the current trends, third, the progress that has been achieved, and finally, the challenges and recommendations for improving clean water and sanitation around the world. SDG 6 aims to ensure the availability and sustainability management of clean water and sanitation for everyone. Clean water and proper sanitation are basic human rights. They are important because they improve public health, support education, help economic development, and protect the environment. This goal also focuses on providing safe drinking water, improving sanitation facilities, reducing water pollution, and encourage efficient use of water. Now, let's look at the current trends and progress. Today, the demands for clean water is increasing because of population growth and urbanizations. Many countries are also using better water treatment technologies and promoting water conservation. In terms of progress, millions of people now have access to improved drinking water. Open defecation has decreased in many regions, and most schools and hospitals have clean water and sanitation facilities. In addition, government and international organizations are investing more in water projects and improving water quality through new technologies. However, there are still many challenges. Many communities around the world still do not have the access to safe drinking water and proper sanitation. Water pollution from factories, agriculture, and households continues to affect water quality. Climate change also causes droughts, floods, and water shortage. Rapid urbanization puts pressure on water system, and some countries do not have enough financial or technical resources to achieve SDG 6. To overcome these several challenges, several actions can be taken. First, government should invest in their better water supply and sanitation infrastructure. Second, we should promote water conservation through public awareness campaigns. We should also strengthen laws to reduce water pollution, encourage water-saving technologies in agriculture and industry, and expand wastewater treatment and recycling. Lastly, international cooperation and community-based projects are important, especially in rural and underserved areas. And as you can see from the graph, illustrates global progress in access to drinking water, sanitation, and also hygiene services between 2000 to 2022, together with the growth rate required to achieve universal access by 2030. Access to safely managed drinking water increased from 61% in 2000 to 71% in 2022, while safely managed sanitation services increased from 28% to 45% during the same period. Basic sanitation coverage rose from 56% to 74%, and basic hygiene services increased from 60% to 78%. Despite these improvements, the dot lines indicates that current progress is insufficient to achieve universal access by 2030. The largest gap is observed in safely managed sanitation services, which we need to increase significantly from 45% in 2022 to 100% by 2030. Therefore, government and international organizations must accelerate investment in water infrastructure, sanitation facilities, and hygiene programs to achieve SDG 6 target. In conclusion, SDG 6 plays an important role in improving public health, protecting the environment, and supporting sustainable development. Although good progress has been made, challenges like water scarcity, pollution, and poor sanitation still exist. With stronger policy, better technologies, and global cooperations, we can achieve the goals of clean water and sanitation for everyone by 2030. Thank you for your attention. That's all from me.